we'll just start. We're good at this.
Apparently, we're just gonna start.
We're just gonna start.
We'll see what happens.
Would you like another opinion on that?
No, but we can talk about second opinions.
I think that's perfect.
Or other opinions. It doesn't even really have to be second opinions. I think
Right.
what we've figured out is that there's lots of different opinions, and when you talk to multiple doctors and you talk to doctors that look at things from different angles, then you get different information, and then you have to, as the patient, it's really your responsibility to decide which of those directions you're going to go, and do your research and stuff. And so we've definitely had that experience with lots of things. You know, I think starting with surgery, that was kind of the route that we took, and it's actually not the only route.
Right.
It's there are plenty of people who do radiation and chemo first,
Right.
and then look at surgery. I am happy with our decision to do surgery because it allowed us to get the bulk
The big guy out
bulk
of there.
of your cancer
Yeah.
removed.
Right.
But that's not the only way to do it. There's other ways to do it.
No,
We could
in
have done
fact,
it the other direction.
Yeah, you could have, you know, there's the thought process that avoid surgery and just go in and do the radiation.
Right.
But we were trying to avoid radiation too. As it turns out, we had too many markers to avoid it. That and the chemo. So.
Yeah, yeah, and in your case, it was really probably the way your lymph nodes looked. Your lymph nodes actually didn't look super scary. There wasn't the kind of look to your lymph nodes that went, ooh, there's a lot of cancer in here. So the hope was that surgery was all that was going to be needed. It turned out that that wasn't the case. But
Agreed.
so that was one thing where there
Right.
were multiple ways to do things. Another thing that where there was multiple ways to do things is chemo. At least that was a discussion. Although really we know now that there's nothing to discuss there. We've got stuff flying everywhere
Yeah.
here. So kind of the two schools of thought there are that the chemo doesn't really do that much for you. Just causes extra side effects, and that radiation is enough. But when you look at the research and when we look at that decision tree that the doctor gave us, it really tells us that if you have these things, if you have these risk factors, chemo is what's indicated from the research. And so that feels like a really comfortable decision. I think we would love to not do chemo, but
Absolutely. And the other thing that all of the radiation oncologists have talked to us about is it's the radiation that causes most of the discomfort and problems. Now there is some nausea that's involved with the chemo, but based on based on the chemo regimen, it's not as difficult for you as the radiation is.
Right.
And related to that is the decision whether to put in a port or not put a port in for the
for the chemo.
For the chemo.
So we talked to two different medical oncologists, and we talked to two different radiology oncologists, just so we were kind of covering our bases. And one of those medical oncologists said, yes, absolutely, you need a port. The other one said, I don't typically do a port. What that really has to do with is the causticness of the drug, how caustic the drug is, and the drug that's recommended for you is cisplatin. That's kind of the gold standard, and it doesn't, from the research, appear to be very caustic to your veins, and so it is safe to do that without a port. Probably safe to do it with a port. That's why those opinions differ, but we kind of heard both from different people.
Right.
The other thing, and we talked about this early in treatment, that was a big sort of deciding factor was the proton center, and whether
Right.
or not you were a candidate for the proton center. And that mattered because so in radiation it's either proton or photon, and that's a science that I can't explain. I just can't. I can say the words, but I can't explain the science. But in the proton, what we do know about the proton treatment is that it causes less side effects. It's much more precise. It's much more. It gets to the cancer and nothing else. When we talked to other radiology oncologists, What they helped us to understand, and where we kind of looked at some research, is that with the kind of cancer that you have, you don't really have, although you did have a tumor, you have a tumor that has spread into a bunch of microcancer in your tissue. And your PET scan shows that. So where the proton therapy is going to be very precise, targeted, we actually need it to be more diffuse. We need the photon therapy that's going to spread out a little bit, because we want to get the tissue that's all around where that tumor was, because there's a little bit of cancer living in all of that tissue.
And logically speaking, that's also going to be why there are a few more side effects, or it's a little bit harder on your body because it's getting more areas.
Right.
So, but you're trying to get more cancer too.
Yeah.
So, one of the other areas that we talked about is, do we do this right away or do we wait to do it?
Right.
And there's some pretty good research about that as we looked into it, that indicates that you really need to do this work, start the chemo and start the radiation therapy before 8 weeks. And that after that there's some degradation in survival rates.
Right. So, and the way that we got to that process was pretty interesting. So the first radiology oncologist said, well, technically you probably shouldn't wait, but I feel comfortable that you can. You might want to heal a little bit more. You might want to take some time to gain a little bit of weight, to just recover in general, so it would be okay to wait a little bit. And then we saw a different medical oncologist, and her opinion was actually, I think you should wait. I think that you should give this some time. You should heal a little bit more. And then she did this really super cool thing that made her super credible. She called back the next day and said, actually, I was wrong. The research really seems to indicate that you need to start this sooner, that if you wait, that the decrement in survival rate is high enough that it's not worth the wait, that anything kind of after 8 weeks, you lose about 10% survival possibility. So 10% is a huge number. And if any doctor at any point had said those words, you lose about 10% if you wait, I would have been like, well, let's not wait ever. We're not going to wait at all. So we did very quickly after that doctor wonderfully said, hey, I think I've made a mistake. I've talked to some other people and they really feel like you need to get started sooner rather than later. I went right into the research and found those research articles. There it is. And you can see the graph and you can see the percentage, and that gives you a good amount of confidence that that's the right way to go. So those are all the things that we've learned and all the information that we've kind of had to balance, and had medical professionals kind of help walk us through that, which is wonderful.
It is, there's a little bit of art to the science. It's still all science, but there's still a little bit of art to it, which is kind of weird considering it's medical science.
Right.
But that's the way it is. People have different opinions on what they've seen. And then there's different opinions on what's in the research. So all of those things are relevant based on people's experiences, and you need to go and have the conversations to understand what you're comfortable with.
Right.
And that's what we did. And even though we've heard some different things, we have some comfort around the choices that we're making.
Yep.
Cool.
That's it. Second opinions.
All right.